I'm Beck from Breathe and Blend Yoga, and today I wanted to go over with you how to identify if you have separated abdominal muscles. So what happens when you have a full-term pregnancy? That's the most common issue. When you have a full-term pregnancy, your muscles, your rectus abdominis, your six-pack muscles, they need to move to accommodate the baby. And in between your six-pack muscles, your rectus abdominis, is a white line of fascia called your linea alba. And so what happens is, as the baby grows, this white line separates and your muscles kind of come out to the side. Now, this happens with everyone that has a full-term pregnancy. Some women are lucky that it just goes back straight away, or more or less straight away. And some women, it doesn't go back. In fact, 70% of women, roughly, have got separated abdominal muscles after birth. And then, I'm not sure what the stats are, though, on how many of that 70% stay that way. So this is how to identify if you have got those separated muscles. So we test in 3 spots: top, middle, and bottom. Now you can do this over a t-shirt. You don't have to pull your shirt up, but just so that you can see more clearly, I'll pull my shirt up so you can see what's going on. So you come down onto your back. Bend your knees. Okay. Then you place your fingers, or find your ribs, and place your fingers in between the ribs. So about where your diaphragm, stomach area is. Then you lift up your chin towards your chest, no chicken necks, tuck it in, and then you test. Now I've got about a 2-finger separation here. It's shallow, which means I can't stick my fingers in very far. You know if it's deep because your muscles will come up and kind of grab around your fingers. So that's how you can tell if you have separated abdominal muscles. And if the depth is quite considerable, then you may even feel things like a pulse, especially around your belly button. You may even feel your internal organs if it's very, very deep. So let's do the belly button. We've done up here, upper abdominals. So you get your belly button. Now, for most people, this is the widest area. It's very common to have this part as the most gap. Lifting. Yeah, see, I have a 2-finger gap. A couple of days ago, that was a 3-finger gap, and I'll get to that in a minute. And then we go lower abdominals, about where your undies, your panties will sit. And I have a 2-finger shallow gap there. So you keep your knees bent, only lift your chin, and 1, 2, 3. When you come up, if you do have separated abdominal muscles, you need to roll to your side and lift. If you jackknife up or try and roll down, this kind of behavior, you see it a lot in yoga classes, this kind of thing where you roll all the way down, I don't think it's actually physically possible, in my opinion, and this is not just from personal experience, this is from study as well, to maintain the control and absolute drawing in of your transversus abdominis as you roll down. Or at some point it'll give, which leaves your lower back open to strain, but it also can pull the muscles apart. So it's not just pregnant women that have a likelihood of having these separated abdominal muscles. You can see sometimes weightlifters and bodybuilders will have these ripped, looks like a 6-pack of dinner rolls, and then they'll have this big gap in the middle. Okay, you can tell more easily on those people because there's no fat over the muscle to disguise the gap. I did a workshop when I was doing my training on this. There was a girl in the workshop who had never been pregnant before, but we all decided to test our muscles anyway, and she had a gap, and she revealed that she had food intolerances that caused her belly to swell up so much that sometimes she would actually look pregnant, and that had quite possibly been the cause of her separated muscles. So the thing is, we're all born with separated abdominal muscles, and they slowly come together through infancy. So they can easily come apart again. So doing crunches incorrectly, for example, doing an abdominal core work incorrectly, can pull the muscles apart as well. It's not just pregnancy, or in this girl's case, bloating and things like that. So that's why we really emphasize drawing in of the pelvic floor and the deep core muscle, the transversus abdominis, as well, when you're doing your crunches, so that you are fully supported and it's not just these six-pack muscles taking the whole load and pulling apart. So that's a little bit of information on how to avoid and identify rectus abdominis separation. Call it a diastasis. The other thing I wanted to go through with you is my own personal experience of going through rehab. So I had a C-section, so I couldn't bind straight away. I had to heal and everything like that. So it was about 6 months before I decided to go through abdominal rehabilitation. So I went to the belly firm and was on their 18-week program. That involved doing belly exercises, drawing in the TA, and using a special binding strap that one fork went across here, one strap went across here, and one strap went across here. And the idea was that you could adjust it to suit your body. However, it didn't work for my body because it was digging into the back and affecting my kidneys, and I was getting a lot of kidney pain. So after about a week of wearing that strap, I had to drop the strap and I was just doing the exercises. Now, in that first week, I lost 10 centimeters from my waist, just from the muscles coming back together. But unfortunately, I couldn't keep wearing the strap. The exercises by themselves weren't enough. So as you could see, I still have separation through the core. So I was doing a little bit of online research, and I came across Lucy's Corset's channel on YouTube, and she has tons of cool, interesting factual information about corseting. And being an ex-burlesque performer, I have a few corsets, and this particular one is from Dark Muse. And her corsets are extremely comfortable for my body shape. If you want more information about that, go to Lucy's Corsets on YouTube. She can tell you more about that kind of thing. But I decided to conduct an experiment. So whereas this the belly band kind of strap didn't work for me, I've worn corsets just for costuming purposes before, and the Dark Muse ones are really comfortable for me. So I decided that I would conduct an experiment over a week to see if corseting would bring my muscles back together. And I have been corseting for 2 days, and I have already lost a 1 finger measurement in my core. So I've taken before pictures, and I'm going to take after pictures, and I have this kind of pooch that would stick out, which is a dead giveaway of separated abdominal muscles. You have this little sort of mummy tummy that doesn't go away. It doesn't matter how many crunches you do and all that kind of thing. So yeah, I've decided to corset, and I'm only doing it for, say, 2-3 hours during the day, and I'll wear the corset at night as well. So being a yoga instructor, I'm very well aware of the risks of and internal issues that could develop from constant corseting, which is why I don't do it when I'm eating or have eaten within an hour of eating. I don't do it when I'm exercising, obviously not when I'm practicing yoga. It's more just when I'm, maybe doing the shopping or cleaning the house or whatever. And I have found that this corset is very comfortable. I'm not having the kidney issues that I was having with the other one. Yeah, in the last 2 days that I've been binding, I have already lost 4 centimeters from my waist. I measured that a couple of times because that was a lot to lose in 2 days. So, and that's just from the muscles coming back together, and that has equated to a one finger gap reduction. So, and somehow the corseting has also just brought in my little pooch. It's sort of coming back in, and that would be repositioning of the internal organs and the belly muscles coming back together as well. So if you want to join me on this little experiment and just keep up to date with what's happening with it, feel free. And if you have any questions, I'll answer them as best as I can in the comments section. As I said before, if you have any questions about corseting and things like that, specifics with corseting, go see Lucy's Corsetry on YouTube, because that's what has inspired me to go through with this process. And yeah, I'll post up the before and after pictures once the week has passed. Namaste.